To my healthcare business owners and operators, if you're struggling with cash or profitability, or you're really not sure what's going on in the business, let me give you some places to start. First off, the 13-week cash flow is a key tool to managing the cash flow in your business, and a lot of times it's kind of easier for healthcare professionals because you have your charges, and your accounts receivable is going to be your cash flow forecast. And so you just have to nail down the expense element of it, and then manage your debt if you have any debt. And so if you need help putting that together, we can help you with that. If if you are having cash flow issues, understanding why is going to be really important, right? So there's a lot of places to start for a healthcare operator. Everything from future slots and bookings, right, to profitability per member, per encounter is really key to understanding. So at least are you profitable on that level? And if you are, there's different things that could be. By the way, if you aren't, digging into your denial codes is a really good one. Gross to net charges, right? Are your contracts in line is a big one. Assuming that you've gone down that, and there are other things, but assuming that is the case, then it may be just a scheduling issue, right? So I like to forecast a schedule of patient visits, and there's some tricks like, if there is no consequence to canceling last minute, it's a lot more likely that that's going to happen, and people are not going to prioritize it, right? So just having a little bit of a incentive to cancel early, and a list of, okay, let's pull up old, reach out to old, or I guess farther out, scheduled patients and accelerate them. That's a really good method to filling vacant open slots. And so in this forecast, you're going to see it as a sort of a regression where in the out weeks, say 7-8 weeks out, maybe 10% of your schedule is filled. And so then you're tracking it. And if you have a gap, kind of like in the 13-week cash flow, if you have a gap 4 weeks out, then you can start planning around that, and your scheduling people can start doing stuff to make sure that that's actually covered too, and that you are using your time efficiently, and there's not these big swings.